Hello, everybody, and welcome. Thank you for joining this special session on ethical and effective medical communication. It's an intersection where journalism meets laboratory medicine. My name is Dr. Konstantin Kanakis, and this is I Don't Make the Rules, I Just Write the News. And it's my privilege to share this story, which is my journey through the ABC News Medical Unit and how the skills honed in media can transform the way we communicate complex science, especially in laboratory medicine, for real patient impact. So who is this presentation for? This session is designed for a broad array of professionals. You can see here I've included medical students, physicians of all kinds, leaders, experts, administration, even families and their patients. I want to stress that every one of these folks can contribute to the fabric of healthcare, and the varied perspectives we all bring to the table are essential for what follows. The laboratory is where truth is uncovered, but communicating that truth is just as crucial as finding it in the first place. Pathologists and laboratorians hold knowledge that can guide diagnostics, therapies, and even public health policy, but that knowledge must be shared accurately, ethically, and clearly, or it risks being misunderstood or ignored. As a doctor on the ABC News Medical Unit, I worked alongside segment producers, senior correspondents, multidisciplinary teams, and the dynamic environment pushed me to translate pathology insights into compelling stories, tailoring the information for mainstream audiences while maintaining integrity in scientific facts. The goals were simple but challenging, right? Report medical news in a way that was relevant, actionable, and above all truthful. Whether summarizing a breaking story from the Journal of American Medical Association or investigating a public health story that was happening right then and there, the media team taught me to distill the research into stories that people could understand and use. We practiced rigorous journalism ethics, right? Seeking truth, minimizing harm, and more. Each of these principles and more mirror core medical ethics that I'll go through with you. And the applications of these ethics can elevate the way pathology communicates both within our interdisciplinary practice and to the public. Whether you're writing a scientific paper or presenting to policymakers yourself, remember what your audience wants: relevance, sociability, variety, depth, and more. Patients, clinicians, and the public all benefit from communication tailored to our specific needs. So here I'm just summarizing the sort of general framework of what I would consider as part of my rotation here. It was this constant evolving cycle of medical journalism, journalism ethics, and what viewers want, like I said. So I want to start with the ethics that guide journalism just generally, right? So this is from the Society of Professional Journalists. Many professional roles, just like ours in laboratory medicine, have professional societies that they rally behind and organize through. So the core principles here that they've published for their own practice are seeking truth, maintaining integrity. You can see minimizing deception, harm, including diversity, addressing conflicts of interest, and acting with accountability and transparently. They're pillars, not just for journalists, but laboratory professionals as well. I saw a lot of familiar tenets here. And when exploring and communicating data that affects patient care and public discourse, you find yourself juggling all of these different facets at the same time. So let's go through sort of the framework together, right? So journalism ethics includes these tenets here. It spans a wide range of deliverables, from magazine articles to published news stories, patient literature, promotional brochures in a doctor's office, ads even, and effective documentation and presentation of data and communicating information in each of these domains depends on clarity, accuracy, and these ethics, right? So let's go through these one at a time. So journalism ethics, distilled down to a few points here, are seeking truth and reporting on it, integrity, minimizing harm, acting without conflict of interest, accountability, transparency, and relevance. So these seem familiar if you've done presentations or if you've worked with patients and patient care. So let's kind of reword them into things that we're more familiar with, right? So seeking truth and reporting on it, I'm just going to go ahead and call that accuracy. Integrity sounds pretty straightforward to me, so that's pretty good. Minimizing harm to me sounds like doing no harm, or the ethical principle of beneficence, right, in medical ethics. So we've got that. Acting without conflict of interest, that sounds pretty reasonable and it's kind of familiar to everybody. Accountability and transparency, low-hanging fruit there, pretty obvious to me. And relevance, maybe in medical practice I would change that to staying up to date, reading journal articles, being at the cutting edge of our practice. And if you replace the edits here with the words that I've chosen, accuracy, integrity, doing no harm, acting without conflict of interest, accountability, transparency, and staying up to date, all of a sudden you realize we're talking about medical ethics, and it's generally the same thing in an ethical framework that applies to a different sort of product at the end, whether it's just communicating or it's communicating data to take care of our patients. So here we are at the crossroads of journalism and medical ethics. So where they meet in laboratory medicine highlight the key principles of accuracy, integrity, transparency, minimizing harm, and acting without conflict of interest. No matter what you're doing, whether it's a clinical trial, writing a scientific paper, doing regulatory documents, brochures, grants, etc., every single format requires adapting your style and rigor to an audience that needs specifics without sacrificing the mission of truth-telling. So let me give you some medical writing examples, right? The transferable skills of journalism and storytelling are pretty easy to overlay on medical writing, right? So these are general examples of medical writing here. You can see medical journalism, educational content, promotional materials, etc. So basically what most of us do in medical lab science or medicine at large is these sort of, framework here shaped like a T, educational content writing, papers, books, chapters, educational material, scientific publication in journals, manuscripts, presentations at conferences like this, whether virtual or in person, regulatory documents. A lot of us are very familiar with very steep regulatory principles, whether they're in study protocols or just lab practice in general. And then grantsmanship, writing grants, getting funding, procuring study support for different things. So very familiar territory for a lot of folks watching today, I'm sure. And then there's also promotional material. You may work in the sales division, in ads, in industry, doing web copy, doing sales training, writing brochures for doctors' offices. All of these things are related in some facet. And we do a lot of this at ACP through things like Patient Champions and other outward-facing entities, especially in our partnerships with industry folks. This presentation, however, is focused on my experience in medical journalism, right? Writing actual magazine articles, medical news, website content, and learning the principles involved therein. Now, I sought this out because I have sort of a multifaceted career. I'm in medicine now. I'm a pathologist, but I was formerly a medical laboratory scientist for about a decade. And before that, I was a double major, and one of the majors was political science. And I was really involved in local, regional, and politics at large. I was fascinated by getting people mobilized in grassroots fashion for the betterment and outcome of the folks in your community. So I have quite exposure to, shaking hands, networking, and learning about what really works to communicate change at a very low to high level. Translate that to my interest in doing this as a resident. I started looking at medical journalism and storytelling and communication opportunities within Chicago, where I am. There weren't too many formal things that I could sort of do while I was in training, except for applying for full-time jobs, which just wasn't an option for me. But I did find something related to journalism that involved a specific internship that I had to apply for at ABC News in the medical studios in New York City. And I found this medical media resident elective. And doing medical journalism with the training of the folks that do this every day as a job, the rotation immersed me and other physicians in a narrative sort of medical framework, doing article writing, live pitching, and the experiences helped me learn how to condense complex findings into actionable headlines, digestible stories that people wanted to learn about, and it's a skill I believe is directly transferable to clinical and laboratory medicine and the education related therein. Media rotations are rigorous, right? This is a full-time, deadline-driven collaborative experience. For lab professionals, familiarizing yourself with a newsroom expectation helps you prepare reports quickly with impact, turning scientific rigor into clear, influential messaging. Every day there in medical journalism training, I was involved in reviewing new studies, pitching story ideas, editing scripts for TV, participating in live interviews, and the multitasking and exciting environment cultivated the ability to adapt, contextualize, and provide the core skills that I believe are definitely a part of laboratory communication. So here are some of the folks I worked with directly during my time there. You can see here that Dr. Jennifer Asher and Dr. Darian Sutton are the actual chief and sort of correspondents there on the news doing what they do best, and they're actual specialists in their field. There are producers, Yuri, Nicole, Eric, and Reynolds, Sony Salzman there. These are fantastic people. They have years and years of experiences. They're dedicated journalists. They are not except for the two physicians there, they are not medical people, but they are steeped and deeply immersed in the world of medical journalism that Yuri is just a fantastic guy that goes into super detail and knows so much about all these different things, and they all really do because they've been doing it for so long. Now, I said every newsroom prioritizes accuracy, integrity, all those ethics, right? It mirrors, I think, the commitment to laboratory medicine to deliver results that are actionable and reflect patient impacts, right? So the discipline in journalism leads you to, award-driven recognition behavior. Here you can see me with some of the crew that I was matched with holding Emmys for that year. I'm back here, by the way, if you're following the cameras. I'm in the frame in the back. And the relentless pursuit of this truth, I think, binds journalism to medicine. So for those of us in the lab, we follow evidence, change assumptions, do scientific methods, and whether you're reporting on a rare disease or writing about a public health issue to teach, your credibility and recognition depends on your actual factual reporting. So collaboration is essential. So, okay, I made it from these experiences in grassroots organizing to residency training to laboratory training to medical journalism training. And in journalism, just like lab medicine, leveraging expertise across interdisciplinary teams from content creators to scientists ensures that the stories that we're telling are accurate and relevant. The teamwork that's built into all this stuff shapes our communication really well. So my experience covering live events, doing things that were recognized with awards, public health stories, highlight the necessity for accurate, ethical, and timely communication, right? Stories like medicine in the general news are grounded by recognizable laboratory data, reminding us that, there's real world impact behind every lab test that we run. Every tube is a patient, right? So the way we communicate that needs to really translate to what people want to hear. Journalism's unique value in the ability to translate that complexity into clarity is the same that stuff that we do in the lab. We have nuanced technical data that we've got to sift through, and we are able to make these intelligible, broad conclusions to empower both of our staff and our patients at large. So the principles of medical journalism I'm revisiting again, right? Accuracy, clarity, balance, transparency, timing, accountability, value, and ethical reporting. The tenets of these core principles are vital in pathology just as they are in the newsroom. We emphasize all of these in every synoptic template, every report, patient consultation, or educational effort that we undertake. These actionable communication efforts mean that every report has a critical value, right? The key takeaway that drives many decisions in all facets of life. The headlines in media are just like the interpretive comments in lab reports. They distill what's most relevant for clinicians and patients, and they highlight a path forward. Accountability, however, is a non-negotiable. I mean, all of the things are non-negotiable, but both fields demand it. Journalism cites sources and admits correction. Lab professionals reference standards, disclose limitations, and prioritize transparency in reporting. There's an ownership, right, that builds a level of trust. So when you consider these ethical challenges on reporting preliminary results on a bone marrow, addressing uncertainty in expected testing, or communicating mixed, controversial, or indeterminate findings, each case requires honesty, an assessment of risk, harm minimization, and learning when to speak and when to hold. Again, both skills that I recognize are at both the intersection of journalism and public messaging. There are times, just as in pathology as there are in journalism, to make sure that you're communicating very critical data in a very sensitive moment. Here is an example from a mass casualty shooting that happened in Kansas City when I was rotating in New York, and we had to cover this in real time. Now, as the medical unit, we covered the data that was coming in from hospital emergency rooms in the area. You can imagine that shootings and casualties require data from emergency rooms, EMS and disaster preparedness folks, morgues, even medical examiners, and because we live in this world of breaking news, somebody's got to go through it accountably and report on accurate, real-time edited news stuff. So whether whether you're on live TV or drafting a critical lab alert, your ability to focus refines what's most important. communicating only on the verified facts, pivoting quickly in response to new information, collaborating with people that have different information with you, working with things like incident command. These are all super, super critical built-in parts of both of what we do. But it wasn't all bad. There were some exciting opportunities there. I was asked to go to a press conference for the World Health Organization's Global Health and Humanitarian Issues conference in that season in February. And I asked a question that clarified some of the tenets of emergency considerations when they were talking about non-communicable diseases. They had talked about different facets of, covering essential services around the world in countries that had limited resources. And I wanted to know a little more about, diagnostic pathology stuff. And we got to have a real conversation there in real time, and it's recorded on there. So it was one of many, many exciting examples. Um, Journalists often ask medical experts for curbsides, right? Curbside consultations, whether it's in the hallway or the elevator, and they validate whether we know something that they need to know or we can collaborate on some puzzle pieces of information, whether something is informative, accurate, or newsworthy. It's the same in medical journalism. People will say, is this worth reporting on, or what can I do differently, or what do I need to add or take away? This mirrors, I think, how laboratorians in the field request data from clinicians or administrators. They assess the scientific merit of things and how those changes may change policy or practice for our patients. In headlines, in media reporting, it frames an audience's understanding. For lab reporting, it means that every summary should look to the answer of a question: what is the actionable takeaway of onboarding a new test, of validating some new assay, of bringing in a new analyzer, all the things that we think about when we're trying to make our own recommendations. In the media, professionals know that surveys often create soft news, right? In the lab world too, we're kind of weary of reports based solely on low-grade evidence, anecdotes, or unvalidated surveys. So we look for robust, peer-reviewed, clinically meaningful findings in those communications. So they train us there, and like we do in the lab, to focus on short, focused, we call them med minutes, similar to rapid lab consults that provide the essentials for immediate action. Every communication should strive to be brief and truthful, and then it always boils down to what can be done or should be done the next piece of information based on what we've learned so far. So in journalism training, we did these study summaries from embargoed articles that weren't published yet. We did curbside script editing. Hey, can I talk about this on the news? It's going live in 10 minutes. And then we also pitched our own stories. So for the curbsides, numerous producers will like email the medical team for curbsides from our experts, right? So they'll ask, is the study okay? Is it valid? Can I say this on camera? Is it correct to say certain ways of drugs or rates of disease or something? What happens if I leave this part out or if I add this? And they also took viewer questions, which were really interesting most of the time. So not everything reported is worth reporting. We asked ourselves a lot, is this reportable? Is it accurate? Does it make the news? Does it help people? These questions refined, which studies we kind of pointed at, and more importantly, which were the best ones that were reserved for ongoing research or more detailed looks. Pitching a story, however, takes a little bit of courage, right? Many pitches won't succeed, but everyone teaches you something as you do this, and the skills are transferable here. So developing clear evidence-based protocols, anticipating challenges or objections, persistence, effective communication is like a science and art mixed in one. And like I said, it takes guts, right? So I pitched 7 over the course of 4 or 5 weeks. One made it through to a news story, 2 are with some journals, and like it was a reduced window of pitches just during my time there for whatever reason. No specifics. It just happens sometimes. But they seek out in all of medical journalism, right, active, dynamic information that's relevant to the people that are be watching. Study summaries were probably something we kind of did every day, right? They extend beyond writing papers. They add context, highlight implications, and suggest the ways the information in embargoed or unpublished articles yet can be used, right? The art of this communication is learning how much perspective to add and how much is needed to the makers of the public. Whether you're writing a validation study, you need some background, right? If you're trying to pitch to the C-suite, you need some background, right? So the study summaries helped hone the skill of not only is something reportable, but does it have a wider sort of application? Is it of critical value? Is it actionable? And can it be turned into a really easy to digest piece of information? So here's an example, one of two here, of a story in JAMA, a neurological paper that discussed traumatic brain injury and had a large study of moderate, severe, mild, penetrating traumatic brain injury over the course of a certain window of years at the Veterans Administration and the Department of Defense. So the text in the top is my suggested headline. The text below it in black, not bold, is the summary of the actual article. And the text in green were my comments to make sure that I give some background information of why it's important and why it's not. So obviously headlines are important, right? So I have to say everything in one line of this. So in this journal, I said one study shows veterans with more severe brain injuries were about 2 or 3 more times likely to develop some types of brain cancer. And I chose those words purposefully and carefully. Based on all the data and studies there, I summarized it thusly. Now in my comments, I sort of explored what they meant by brain cancer. I questioned whether or not these were diagnosed with final official biopsies, whether they were staged appropriately, whether they were cancerous or precancerous lesions like meningiomas, etc. I sort of used my pathology experience to sort of assess whether or not this was the most accurate thing. And I put my concerns, objectives, and thoughts here in the context so that when somebody saw this, they would understand what I would understand. And this was officially reviewed and signed out by me like a pathology report for the journalism team. Another example here, a new study finds roughly 1 in 10 pregnant people will develop long COVID. I summarized the article there that they did this study with follow-up, studying like 1,500 patients who were pregnant and looking at rates of long COVID and things like that were in the American Journal of Obstetrics and Gynecology. My comments here looked at the potential differences in long-term versus short-term COVID and the sequelae associated with SARS-CoV infection between pregnant non-women. And I didn't see, that there was specific findings that would reflect it. I highlighted the authors noting the complexity of the study, the need for more long in-depth assessments. And I kind of said this was like a soft conclusive study that needed a little more, and whether or not it made it, I don't remember very well, but I probably went through 50 or so of these over 4 weeks, and they were all great. Now this is a lot of text, but if you're a student, if you're a resident, trainee, or anybody that's dealing with stats, or if you just read a lot of journal articles, just screenshot this to save it for yourself later. It is the trusty hand guide to understanding how statistics are reported here. Summarized here are risk ratio, odds ratio, and hazard ratio. Both to show you how one would word a title or a titular finding in a study. For example, let's look at risk ratio, right? So risk ratio of 1 means both groups have the same amount of risk. A risk ratio that is not 1 means that there's some kind of difference one way or the other. So for an RR of 0.85 of less than 1, this means that, for example, those that had the intervention experienced something different 15% lower than those that did not. On the other hand, 1.45 means 45% higher, translated to out of 100 there. Same sort of explanation for odds ratio and hazard ratio. You can see that relative to the number, you can say something is a higher risk or lower risk, or odds of something. We try to avoid the word association. We try to avoid causation because those aren't, really helpful to anybody specifically. And most importantly, we do not report on figures that aren't statistically significant. And you know what? Neither do the folks in the lab. So this is transferable, equitable information here. And I really, really, really suggest that you screenshot this because this was really helpful and I kept it up by my desk almost every day. So a lot of the things that you see on the news relate to celebrities. You just can't get away from it, right? So here is Amy Schumer and Wendy Williams, both stories that came up, during the time there. Amy Schumer with her diagnosis of Cushing's disease, and Wendy Williams with some frontotemporal dementia diagnostic diagnosis there. So recent celebrity cases, they range from all sorts of things: vision loss to cancer, and they're underpinned in every story by laboratory findings. People want to know, how do I get tested for this? When does something mean that I have a disease or disorder? The coverage is super important because it demonstrates how the public understands the technical diagnostics, relying on plain language explanations, and how well communicated lab results become key points of public dialogue. So for every high profile diagnosis, there was laboratory data that I got to sift through to discuss microbial cultures, genetic panels, immunostains, flow cytometry, and more and more and more. Translating those findings to the public meant breaking down the complex testing principles into understandable narratives and highlighting the impact of patient relevance. So, in the last year or so, here are the celebrities that have come out in the news with some kind of significant diagnosis or health issue, and I've included their status there so that we can, we can not worry about them with good prognoses there and stuff. But I, as one of many lab professionals, become a vital educator in this context when we use these real cases, familiar procedures, and patient-centered language that creates an effective teaching algorithm that stems from the stories that we use to connect with these laboratory and scientific findings as part of broader health conversations. Here, you can see just in 2025, the same thing. People have come out with different diagnoses and health issues. Now, this is already public. I'm not publishing anything. Nobody's breaking HIPAA. But this stuff is in the news media, and you can see that a lot of these things are complex diagnoses that you will recognize that require significant workup. In fact, I've summarized these into a table here to show you the impact of the laboratory and diagnostic data involved with a lot of these diagnoses, right? So for something like, non-Hodgkin's lymphoma, we have to do biopsies, flow cytometry, immunohistochemical staining, cytogenetics, maybe bone marrow, CBC, lab test, hemolytic labs, and more and more and more. For things like Lyme disease, you might have, two-tiered ELISA testing, you might have labs, you might have to check other organ functions, and the list goes on and on and on. Everything, right, is lab testing. Two-thirds of all clinical data is lab information. So it's a lot of stuff, and I was really, really excited to be an expert in translating this stuff while I was there. This is actually one of the stories that I pitched that made it to the website and to news. There was a lot of stuff happening in the state of Alabama related to in vitro fertilization during February of that year, and I wrote a sort of roundup, what you need to know about IVF as a fact list while the courts kind of decided what was going on. So I wrote a piece there, the 5 things you need to know. It's still up online. And it's exciting, right? So as a pathologist, as a laboratory professional, I found myself literally at the forefront of pathology and public health. I was advocating for things, I was advocating for people knowing all the information, for better screening, reporting gaps in health disparities, new standards, delivering informations on cytogenetics, or what we do as practice leaders that influence policymakers and journalists, and hopefully not the other way around. I helped to write clear and accurate information for the public good, right? That's the mission behind all of these things. I tried to communicate from all those facets of webinars, consult, media interviews, articles, journals, study summaries. The duty behind that was to the truth for the people affected by what would be written. Laboratory is the source of public health data, 100%, even policy. How you communicate and move through the conversations between specialists and lobbyists to media to policymakers ensures that pathology has a permanent impact, and I hope, or at least I tried to make sure that it was understood and appreciated and acted upon. So I have done this presentation before. I have delivered it to a small communication workshop here in Chicago at a couple different schools. And at this point, I usually kind of go to my ABC News Outlook, which I still have, and I look up some live study summaries that they're doing, and I kind of work through them together so you can get a flavor of what that is right now. But since it's a pre-recorded thing, I thought we would do something different. So what we'll pivot to right now is an example or two that I have kind of arranged just to put everybody in familiar territory, right? So I already talked about a little bit of like miscommunication and failure with dire consequences, right? Misdiagnoses, public confusion, delayed results because of errors. we always try to avoid the pitfalls by building strong workflows, fact checking, having, controls and all this quality metric stuff that we do. And perhaps the biggest challenge that I have found that is shared between the two fields of journalism and laboratory medicine is simplifying without dumbing down and simplifying without using jargon, right? So some kind of happy middle ground that renders the data approachable for clinicians, patients, and even audiences, right? So using analogies or structured templates or clear language or visual aids bridge the divides. But what happens when you can only use text, for example, like in a patient chart? So let's do an example really quick. So let's play which is better. So here I've gathered 4 notes on 4 patients. We'll go through them one by one, right? So if you're not an expert at medical abbreviations, I'm going to do this for you together. 46-year-old male with a past medical history of hypertension, type 2 diabetes, refractory anemia, with new onset pancytopenia and blasts concerning for hematologic malignancy, peripheral blood smear with features consistent with dysplasia, admit and refer to heme. That's note number 1. Okay. Patient number 2. 46-year-old male with decreased hemoglobin, now decreased white cell and platelet for 1 week, received 4 units of red cells, no transfusion reactions, hemolysis labs are negative, smears show nucleated RBCs, left shift with a few blasts, currently in path review. Okay, bookmark that one. Patient number 3, 46-year-old male, worsening pancytopenia and circulating blasts, no history of malignancy, differential diagnosis includes myelodysplastic syndrome / AML, chronic myelomonocytic leukemia, bone marrow failure, other, rule out infectious, order CBCs, bone marrow biopsy, liver function test, complete metabolic panel, lactate dehydrogenase, haptoglobin, bilirubin, infectious workup, DAT Coombs test, hemoglobin goal is over 7. Cool. Patient number 4. 46-year-old male with pancytopenia being managed for possible induction and or transplant, normal karyotype, MDS genetics panel is to be done today. Next gen sequencing panel pending. 5% blast on CBC. So which one's better? Well, the first one, second one, the third one, and the fourth one, they're all the same patient with notes from different specialties or practices, right? So the first one might be a medical professional or a nurse. The second one might be a lab professional writing a note in a logbook. The third one might be a specialist like a hematology oncologist. And the fourth one might be a hematopathologist writing a history and a bone marrow report, etc. So let's go through them one by one, right? So first one's not bad. There's some quick history there, some alarming signs, right? And this patient's headed to hemonc for sure. Cool. Second one, again, not bad. Get some more information on the refractory anemia here, how much they've received and what's been going on with that. Pathology review is pending. That's good to know that it's something that I can call about. Third one's not bad. Again, heavy heme assessment, a little more detail there about the differential. Labs, transfusion goals. I can see the context through which the clinical side is looking at this patient. And the last one, again, not bad. There's expectations here. The testing gives clue to what's being, preliminarily considered as a diagnosis, and the timeline has been established. So in all of these, blasts were mentioned, which is a critical sign, right? So there's blasts in the peripheral blood on all of these, but only one has quantified it. One quantified 5% blasts on CBC. Okay, cool. So again, the summaries weren't bad in this context. A lot of helpful information, but what is actionable here? Are they any different really? What is relevant in their histories and their lab results, in their timelines? Is there any predictability that we can glean from some of that data? Blasts were mentioned everywhere, but only quantified once. That's huge. That's probably the linchpin of the most important thing here. Is the 5% only in the CBC or is it also in the bone marrow? If it's truly MDS or AML and there's only 5% blast, is it MDS with low blasts? Does the bone marrow, have 100% blast involvement? Are there specific cytogenetics? One report said that there were normal karyotypes and no cytogenetic stuff, but NGS is pending. We're stuck, right? But we have little pieces of information that different specialties recognize in different ways. And that's sort of the lesson in how different people in news media see different parts of studies. So why communication matters, especially in pathology? Again, I will re-stress that we sit at the intersection of clinical care, public health, medical lab science, right? Communication is the bridge. It connects the domains, that improves outcomes, advances understanding, and makes sure that the language builds on the connections and not the barriers. Real patient stories highlight consequences of good and bad communication. When pathologists explain findings effectively, patients are empowered, whether it's to them or to their clinicians. When information is withheld or it's unclear, outcomes suffer. Champion storytelling as a change agent. I urge all of you, right? So if you think about the CBC example with the blasts a few slides ago, that translates to the way different people saw news articles, right? I am here looking at papers, looking for relevance, accuracy in medicine, accuracy in scientific rigor, statistical reportability, but a journalism who is not a physician or a laboratory scientist might just want to know, does this mean that X equals higher risk of cancer? And when we communicate clearly, we shape that relationship and for good, I hope. Again, communication matters a lot depending on who you're talking to. We focus on the accuracy of what we talk about, and it's our duty to public knowledge and outcomes to report that accuracy. Our communication focuses, on our failures, our shortcomings, and our costs. And if that's all that gets focused on, we tend to look bad depending on the story that's happening, whether it's recent ones about LDTs or making up tests or things like that. We make complex things digestible and understandable. Um, there's an adage in the new era of news media where you have to make things so easy to understand that you can keep the TV on or listen to a news piece on your phone while you're doing the dishes or while you're folding the laundry. And you have to make it simple enough that somebody who's not paying 100% attention can understand that smoking can cause cancer or smoking can increase your risk of cancer. And our impact, such as that, is our relationship to the public discourse as pathologists, as experts. And when we talk about this stuff in public forums like conferences like this, that's where it comes out. We are also the champions of making sure that tenets of diversity, equity, inclusion in reporting affect everyone, right? Health is apolitical. Health is not subjugated by limitations. We all have considerations to make sure that we're all healthy and live the best quality of life. And it usually is negatively or limited by policy and things without our advocacy and effort. So we have a lot of effort there. Ethics in laboratory communication, again, tantamount, super important to making sure that the way we communicate things are actionable and relevant and fair. Now, I think that we have a role as pathologists and laboratory professionals as advocates, as educators, as partners, as peers. And our current digital era of communication means that you kind of are forced or have to stay up to date with easier and easier tools at your fingertips every day. But ultimately, why it matters is you making, conclusions and things based on data in your setting, as small as it may be, can impact 1 to millions of people. So here's, a snippet from my website, and I've had the pleasure and honor of doing a lot of this stuff for ASCP directly. And I've had quiz shows, which I'll be doing at this annual meeting. Please come find me if you're around. I get to do the monthly e-policy news update where I talk about the exciting things happening in Washington. I've talked about my experiences in medical training and education, in being a patient myself. And even this is talking about my personal experience, which I am honored that people want to hear about the things I do, but I think that they're translatable to the things that everybody gets to do. And I think that's really, really important. So, how does this stuff that I'm talking about apply to your everyday experience as a pathologist, as a laboratory professional, a manager, or somebody in administration? So, there's tons and tons of things you can do. Whether it's publishing a paper, which is the gold standard for scientific discovery, when you're writing it, whether you're maintaining rigorous standards or citing sources clearly and using narratives that connect the data to the outcomes, you're making science relevant and relatable to broader audiences with every paper or article that you get in a journal. Even when you write regulatory documents, it demands precision, clarity, and not just compliance. Well-written protocols can save lives. They can apply the lessons of journalism of checking facts, avoiding jargon, ensuring transparency, and those communication skills directly affect success. Effective grant writing has also made a compelling case. It uses actionable narratives and demonstrates the link from laboratory data to community benefit. And health education and promotion, including the up and budding topic of pathology clinics, requires a delicate balance of accuracy and accessibility. Avoiding exaggeration, using plain language, anchoring your claims in validated studies and evidence. It builds the trust and it motivates informed choices and empowers people to make better inquiries on their own care. Patient education specifically, it meets patients where they are, right? It assesses their literacy, clarifies technical terms, takes steps to help them find the next actionable move, and involves them more in their patient, and it makes your materials effective for more diverse patient populations. So what can you do? You can engage with audiences. You can find out what they need. You can pitch your stories, whether it's to journals, to blogs, to your C-suite, whether it's to buy something new or make a change. And you can seek out practical tools and develop your effective communication skills. Speaking publicly, whether it's at a conference or in a clinic, it offers opportunities for advocacy and education. You organize, prepare your points, you anticipate questions, you tailor your message to your audience. It's an exciting exchange, and doing this with more practice makes you more clear and more credible, and it makes you look like you're doing this more naturally. When you pitch your stories to executives or leaders or different communities, you should focus on outcomes, relevance, cost effectiveness, patient impact. You can use these media training techniques that I've been talking about to get straight to the point, to use the data wisely, and to build your case for actionable results. If you're thinking bigger, if you're worried about lobbying, if you're talking to policymakers or peers, all your audiences differ, but you get to actively engage them and see what they want, what they need, and tailor those explanations appropriately. Please never underestimate the value of empathy as well in your communication. Feedback makes you a better person, a better communicator over time, every time. I remember a specific series of phrases that is on a roundabout in the island of St. Martin when I lived abroad for a few years. It comes from the Rotary International, right? And as you drive around this roundabout, there's a little message on the side. It says, "Is this the truth? Is it fair to all concerned? Will it build goodwill and community? And will it be beneficial to all concerned?" Now, that is a great framework to ask yourself this four-way test. It's a famous four-way test to see if something is ethical or if it's fair, right? And if you apply this to your efforts in laboratory medicine, communication, public speaking, whatever, you will find that you will highlight gaps, address disparities, and just be a better communicator overall. So if you have structured templates, you will find that you miss things less and you will include more relevant information. If you continue to seek out professional development, you will hone and sharpen your skills. If you know when to speak and know when to not speak, you will make your evidence stronger and you will make your case stronger. If you share your own experience like I'm doing with you all today, that makes you a better communicator just for the fact that human beings love storytelling. That's the crux of the way we understand our contextual relationship with each other, with our communities, and it just makes you applicable and accessible to a wider audience. If you ask yourself, will it change outcomes? You are mission driven to make sure that someone benefits from this, whether it's a patient or community. And if you use the phrase critical value, just like we all do every day, it's an actionable takeaway that translates to something that, again, goes back to having a positive outcome. So I'm going to return to this slide where I talked about medical ethics and accuracy, integrity, doing no harm, the tenets of journalism ethics and medical ethics going back and forth, and taking those back and forth and addressing what people want in all of our facets lead us to effective and actionable communication in pathology and medical laboratory science. The tenets of journalism ethics give us the accuracy and accountability that we, align with these ethics. And when we think about what people want, we think about our audiences, our colleagues, administrators, politicians more. But ultimately, it's about our patients, right? We're all in the medical field, so it's about our patients. So Media and medicine intersect. I am confident that I have convinced you of this, right? So whether you're talking about disaster response, emerging research, health advocacy, laboratory professionals with media training, I think communicate with clarity, manage uncertainty. They respond rapidly to new developments and bridge the gap between science and society. I hope that you all embrace ongoing learning through workshops, simulation training, interdisciplinary action, and dedicate the time that you need to refine your media and messaging expertise. I think the standards of communication are constantly evolving, and we should evolve with it. So, in closing, I hope you practice actionable, ethical, audience centered communication. I hope that you seek opportunities to share your experience and educate colleagues and advocate for the laboratory at large. And I hope you remember that every message, whether big or small, shapes the public understanding of our profession and our reputation as pathologists and laboratory professionals. Thank you again for joining this session. I appreciate it so much for taking the time to watch this video. Please stay curious, stay committed, and ethical in everything you communicate. Use your platform, big or small, to advance science, equity, and the public good through effective messaging. And for further reading or engagement or collaboration, please reach out directly to me. Explore the resources on medical journalism and laboratory ethics online. They're everywhere. Look at communication best practices, and let's continue to elevate the laboratory's voice stronger together for a healthier, better, and informed world. I'll see you at the annual meeting. Please come say hi, and hope to see you soon. Thanks.